Welcome to Crack Surgery. Today we are going to discuss very important topic, that is SUS, systemic inflammatory response syndrome. It is a life-threatening complication of an infection. Sepsis occurs when chemical release in the bloodstream to the fight the infection triggers inflammation throughout the body, thus can cause cascade of changes that damage multiple organ system, leading to fail, sometimes even resulting in death. These categories is following these categorized in following categories, that is SARS, sepsis, severe sepsis, septic shock, and MODS. First category is SIRS. As name suggests, it is response of inflammation. It include temperature, heart rate, respiration, and WBC count. If temperature is more than 38 degrees Celsius or more than 10 more than 100 degree Fahrenheit, or a temperature less than 36 degree Celsius or less than 96.8 Fahrenheit. The normal temperature is 37 degrees Celsius, that is 38.7 Fahrenheit. Secondly, in SARS, heart rate is more than 90 per minute, and respiratory rate is more than 20 per minute. That normally it is 12 to 15 per minute. PCO2 value is less than 32, it due to hyperventilation, more elimination of carbon dioxide. Normally PCO2 value is 40. Last category is WBC count. More than 12,000 or less than 4,000 cells per cubic millimeter. Out of this, presence of 2 or more than 2 out of 4 is considered as SIRS stage. That is systemic inflammatory response syndrome. It is a mild stage. Then it goes severe in second categories, that is sepsis, when SIRS with confirmed source of infection is termed as sepsis. Third one is severe sepsis, in which organ dysfunction with hyperperfusion, in which systolic blood pressure is less than 90 degree 90 mm of Hg. There is a more than 40 millimeter of Hg fall of BP from the normal BP. There is lactic acidosis, oliguria, or acute mental status changes seen. There is third category, that is severe septic shock, in which there is fall of the BP with which does not respond to IV fluid. Generally we give 30 ml per kg. If according to this, if uh, uh, we insert IVs, if patient not responsive, then it must be in septic shock. Last one is MOD, multiple organ dysfunction syndrome. There is more than two organ dysfunction seen. There is a rapid breathing, abdominal pain. Generally, there is a liver failure which cannot eliminate the toxins present in the blood. So, it is a life threatening conditions. Thank you.